Hi everyone, so today we're going to be looking at another definition of abnormality, which is statistical infrequency. So far we've already looked at deviation from social norms, and today this will be our second definition. So we're going to be looking at defining the key terms in the key terms list on the right, and then applying this to different scenarios to see whether a person is normal or abnormal, and then finally thinking about the strengths and weaknesses of this definition in terms of whether it's useful or not in deciding whether someone is abnormal or not. So looking at the picture in the top right hand corner, I want you to identify the type of distribution that's shown. Make sure you justify your decision and identify where the mean, median and mode should be. Then I want you to explain how this could be used to define abnormality according to the statistical infrequency definition. And then what do you think, what kind of person would be considered abnormal according to this definition? So pause the video and have a think. So hopefully you should have said that this is a normal distribution. You should know this from your research methods work. You should therefore also know that this is a mean, median and mode should all be at the top. And both of these you know because it is a normal distribution as the curve is equal and looks the same, it's symmetrical on either side. And that there is the key percentages, for example, in the first standard deviation there is 69% of people fit into that. This definition suggests that anyone who does not fit in that usual norm, so in that main bulk of the normal distribution, is considered abnormal. For example, someone who has a very low IQ would be considered abnormal because there'll be very few of those in the population. So this is the graph that we're looking at. So you're looking at the frequency in population, and in this case as an example IQ scores. So we know that the average IQ is 100 and a low IQ, so an abnormal IQ would be 70 or 120. Statistical infrequency is a person's trait or thinking or behaviour would be considered an indication of abnormality. So what we're saying here is that if someone has a rare or is uncommon in terms of the population, then they would be considered abnormal. And therefore anyone who falls outside this normal distribution is obviously not normal, and this counts as within two standard deviations. So we can see the kind of olive colour and the blue colour, those are within two standard deviations. So anyone who falls within the yellow or the grey would be considered abnormal. We need to consider though that this view is culturally relative, and that means that it sticks within one culture and maybe we can't apply it to other cultures. So can you think of an example where a behaviour is statistically rare in the UK but more common in another culture? So you might have thought of, for example, crowds around buses. In the UK, we would never crowd around a bus, we would wait and queue for the bus. Whereas in other countries, like in Europe, they often just all cram in and get to the bus. There's no social norm, I guess, for queuing. But is infrequent always undesirable? So have a think of an example of a behaviour that is infrequent and undesirable, and so supports the definition, and one that is infrequent but desirable. So hopefully you should have thought of some examples. One example would be that is infrequent and undesirable is being terrified of the colour red. So if you see any colour red, you panic, you can't cope, and you need to you often stay at home and avoid going out to see the colour red. This would be infrequent. It's very unlikely that you've met anyone with this phobia, and also undesirable. It's not helpful to you to be scared of the colour red. However, having a high IQ, so saying having an IQ of 130, is very uncommon, but it's also very desirable. We'd like to have a high IQ because that would be beneficial to us. So sometimes this is a problem because actually, although things are statistically rare, it doesn't necessarily mean that they're not useful or desirable, and therefore just because they are abnormal according to this definition doesn't mean it's not a positive to have it. So when you're thinking about evaluating it, You might talk about the fact that some things are statistically abnormal but desirable, like high IQ. You also are going to talk about the fact that actually it's very culturally relative. So, for example, schizophrenia or hearing voices in this country is statistically rare. We don't know many people who speak to the dead or hear voices, and therefore it's statistically infrequent, and we would diagnose them maybe with schizophrenia. However, in another country, it is common for people to hear voices, and therefore they wouldn't be diagnosed with schizophrenia. So depending on where that person is from, they could get two different diagnoses. So if they came over to the UK, they might be diagnosed with a mental health disorder, but actually in their culture it's seen as acceptable and frequent and common. However, if someone's leading a happy and fulfilled life, is it beneficial to label them as abnormal? For example, if someone has really low IQ, do they need to be labelled as abnormal? If they're still having a really happy life, they can still work, they can still function, they can live on their own and be independent, does it matter? So is the definition helpful to members of society? You could even refer to social sensitivity and talk about the fact that actually it's quite socially sensitive, and you need to think about how you suggest to people that they're abnormal even though they're happy. Is that okay? However, the definition could be useful alongside other definitions of diagnosis. So for example, if we use social norms and statistical infrequency, that might be more helpful. But it also might be particularly helpful in identifying the severity of the condition. So for example, we know that, as if we go back to our earlier example of being scared of the colour red, that we would count that as severe, and therefore we would know that we definitely need to do something about it. Whereas, I don't know, someone being scared of dogs, we probably don't need to, we might not need to act on that because it's more common and therefore it's maybe less severe. Hopefully that's helpful. Thanks.